A very good morning to one and all. Today we are going to discuss about the topic hearing loss or deafness. It is very important for your exam. Let me introduce the topic. Hearing is one of our primary modes of communication. 360 million people worldwide have disabling hearing loss. Hearing loss may result from genetic causes, complication at birth, certain infectious diseases, chronic ear infections, the use of particular drugs, exposure to excessive noise and aging. So hearing, it is one of the primary mode of communication to communicate with other or conveying the message. Hearing is very important. Without hearing, you can't able to communicate with the people. So we have seen in the speech defects also, as one of the main problem for speech defect is hearing loss. Okay, so if hearing loss is there means then speech defect also will be there, because if you are not hearing anything, then it's very difficult to or not able to communicate with others. And in worldwide, you can see that around 360 million people are suffering from hearing loss. Either it is a temporary or a partial hearing loss will be there, and mainly it is occurring due to genetic causes. Okay, hereditary it can occur, complication at birth or congenital anomalies, then certain infectious disease, some ear infections, then chronic ear infections, then particular drugs, use of particular drugs, that is ototoxicity, then exposure to excessive noise, and in aging also hearing loss will occur. Let us discuss in detail. First of all, definition. Hearing impairment or hearing loss refers to complete or partial loss of the ability to hear from one or both ears. So, what do you mean by hearing loss? It is a complete or partial loss. Hearing loss we can call it as complete or partial hearing loss. So, if it is a complete or partial loss of ability to hear from one or both ears, either one ear or both ear. If the person is not able to hear the sound properly through one ear or both ear, that we can call it as partial or complete hearing loss. The level of impairment can be mild, moderate, severe, or profound. So depending on the impairment or hearing loss, we can classify it into mild hearing loss, moderate, severe, and profound. Then deafness means it refers to complete loss of ability to hear from one or both ears. So little difference is there, hearing loss and hearing impairment and deafness, or hearing impairment and hearing loss. Hearing impairment means little bit disturbance will be there, and hearing loss or deafness means complete loss of ability. There will not be any ability to hear the sound. Let us see the risk factors. Family history of sensory neural impairment, congenital malformation of the cranial structure, if any congenital malformation in the structure of the ear, then family history, low birth weight, then use of orthodox medications like the gentamicin or loop diuretics, then recurrent ear infections, then bacterial meningitis infection of the brain, chronic exposure to loud noise, one of the main cause for hearing loss, perforation of tympanic membrane, any severe infectious disease in the tympanic membrane. These are the possible risk factors which can lead to hearing loss. Let us see the types. Mainly it is of three types: conductive hearing loss, sensory neural hearing loss, or mixed. So conductive hearing loss or deafness means it due to defect in the conducting mechanism of the ear, namely external and middle ear. So in the ear you can see mainly it is divided into three: external, middle, and inner ear. External and middle ear are the part where the sound impulse or sound waves is conducting towards the inner ear. So if there is any defects or deformities or any problem which is obstruction or anything which is occurring in the external and middle ear, can lead to conductive hearing loss. So here the problem will be the sound waves is not reaching the inner ear. Sensory neural hearing loss or deafness means due to lesions in the labyrinth. It is involved in the inner ear. Labyrinth that is present in the inner ear. Then eighth cranial nerve and central connection. Eighth nerve, cranial nerve, is vestibulocochlear nerve that is responsible for the auditory functions. Then central connections. Then it includes psychogenic deafness. So sensory neural means which is affecting the inner ear, especially the labyrinth, membranous labyrinth, and auditory nerve, that is vestibulocochlear nerve. And mixed means in that both will be there. Conductive and sensory neural hearing loss will be that we can call it as mixed hearing loss. Let us see the causes. First of all, causes of conductive hearing loss. In that external ear, what are the causes? Wax, impacted wax, fungus infection, otitis externa, inflammation of the external ear, then foreign bodies, polyps or growth, then meningitis, okay, then stenosis, any narrowing, atresia means there is any obstruction, abnormal closure of the external ear, then tumors, any new growth. Then middle ear, you can see the congenital defect of the eardrum and ossicles. If there is any congenital defects in the eardrum or of ossicles, then traumatic, it including barotrauma, means the rupture of the tympanic membrane due to increased pressure inside the ear, then rupture of eardrum of the base of the skull, then inflammation like acute otitis media, chronic otitis media, serous otitis media, adhesive otitis media. These are the different types of otitis medias. Then tuberculosis and syphilitic otitis media. One of the complication of tuberculosis is tuberculosis otitis media. Then neoplasms and otosclerosis or hardening of the ear bone. So these are the main causes of conductive deafness in the middle ear. Then in eustachian tube, we can think that eustachian cataract. Cataract means excessive discharge from nose or throat or ear. That is means cataract. So from the eustachian tube, if there is any excessive discharge, then eustachian tube dysfunctions due to disease of the nose, paranasines and pharynx. So we have seen that we already studied that there is a connection between middle ear and nasopharynx with the help of eustachian tube. So if there is any upper respiratory infection that can spread to the ear through eustachian tube, then barotrauma, okay, that because of pressure injury. Then sensory neural causes are, deafness causes are local causes including congenital, then trauma including head injury, surgical injury to labyrinth, loud sounds, then chronic acoustic trauma, okay, then producing concussion. So these are certain traumatic injuries. Then infections like mumps, syphilis, tuberculosis, meningitis, entering fever, labyrinthitis. These all conditions we already discussed. Then tumors like acoustic neuroma, that is one of the ear tumor, or schwannoma of cranial nerve 8. Okay, it's the tumor which is occurring on the cranial nerve. Then Meniere's disease, ototoxic drug like streptomycin, kanamycin, neomycin, salicylates, furosemide, and quinine. So some of the antibiotics and loop diuretics can lead to ototoxicity, or it will affect the ear. Okay, it can lead to ear infections. So these are the causes, local causes for sensorineural deafness. Then general causes including presbycusis. Presbycusis means it is a progressive bilateral symmetrical age-related sensorineural hearing loss. It is also known as age-related hearing loss. So in age people, those who are above 60 or 70, there's a chance of partial or complete hearing loss, that is called presbycusis. Okay, so it is a progressive bilateral symmetrical age. Both ear it will affect. Then cardiovascular diseases like atherosclerosis or hypertension, central nervous system disorder like disseminated sclerosis, then diabetes mellitus, avitaminosis or absence of or any lack of vitamins, then hypothyroidism, smoking and alcohol. These are the general causes which can lead to sensorineural deafness. Let us see the psychogenic deafness. Okay, psychogenic deafness means it is of two type. One is functional, due to emotional cause, but the patient is not aware of the cause. Due to some emotional changes, there is a chance of deafness, but patient is not aware about that one. Then malengineering, that means no organic or psychological cause. In behind this malengineering type, there is no organic or psychological cause. The patient is aware that he is pretending to be deaf for personal gains. So some people you can see, especially in age people, in order to understand the communication of the family members, sometimes they will act as a deaf. Okay, so they will tell that I can't hear, or it's very difficult to hear, you please raise your voice. So in that conditions, maybe sometimes when talking some in order to identify some family talkings, they are pretending to be act as a they might knowingly they are acting as a deaf. That is called malengineering. There will not be any organic or any psychological or physiological reason. So these are the causes of sensorineural deafness. Let us see the causes of mixed deafness. It including trauma like blast injury because of sound explosion, acoustic trauma or a nerve injury, head injury, then chronic suppurative otitis media with labyrinthitis, otosclerosis or hardening of the ear bone, senile deafness or age-related deafness superimposed on conductive deafness. Okay, so these are the causes of mixed deafness. Let us see the pathophysiology. A small pathophysiology is there. Damage to the outer, middle, and inner ear or aging process, exposure to loud sounds. So these are the main causes or etiological factor behind hearing loss. So what will happen because of all these etiological factors? There will be a cause wear and tear on the hairs or nerve cells in the cochlea that send sound signal to brain. So inside the cochlea there are glial cells are there. So that will helps for the movement of the sound waves to the brain. So there will be some wear and tear will be occurring on the nerve cells in the cochlea. So due to this, what will happening? Electrical signal cannot be transmitted efficiency. So the sound waves is change. It is converting into electrical signals, and it will be transmitted to the brain. That particular process will not be taking place properly. Can lead to symptoms of hearing loss, such as asking the other person to repeat again, once again, or leaning forward to to hear the sound. People are leaning towards the or they are moving towards the other person. Okay, so this is a pathophysiology. Let us see the signs and symptoms. Most hearing loss gradual and goes unnoticed by the client. Some of the hearing loss are not noticed by the people itself, especially in age related hearing loss are not. So day by day the hearing loss will be progressing, but they will not identify in fast or in the early until several incidents of communication problem have occurred. So when we will identify the hearing loss, when repeated attempt of hearing loss, that time we are going for identifying. Second one, failure to respond to oral communication. So if somebody is talking with you, if you are not responding to their for their questions, so that is a sign for hearing loss. Inappropriate response to oral communication. If somebody is asking you where are you what is your name, so instead of that question, if you are telling that I'm going to Jagdalpur, so that is a inappropriate response. Okay, or if they are asking what time is now, so if you are telling that today is Saturday, so that is a inappropriate answer. So that is happening because of the hearing loss. Then excessively loud speech. So if you are having hearing loss, so you will hear in a slow voice. So it will be automatically, it will you will try to increase your sound while responding, so you will also talk in a loud speech. Then abnormal awareness of sounds. Okay, you will hear some kind of abnormal sounds. Okay, strained facial expression. So there will be some changes in the facial expression, because when you are if you are not receiving proper sound or proper loud noise, then your face also will be changing, because in order to, some strange faces will be there. Then constant need for clarification of conversation. So again and again, if you are asking that could you please repeat it, or I can't able to hear, once again can you repeat. So these are signs of hearing loss. Then listening to radio or TV at increased volume. If you are listening the radio or TV in an increased volume, that also will be a you can't if you can't able to hear the volume under 20 decibel, that means you are having some hearing losses. Then next one is diagnose. How we can diagnose? First of all, history collection, because family history is there, congenital malformations are there, then infections are there, medical histories are, medical conditions are there. So proper history you have to collect according to this all things. Then also you have to ask about the lifestyle and habit, because smoking, alcoholism can lead to deafness. Then physical examination, proper examination should be done. External inner ear examination should be done properly. Then for this you can use Rennie test and Weber's test, that is a tuning fork test, to identify the conductive hearing loss. Then audiometry examination helps to identify whether the sound waves are properly generating or not. Then auditory brainstem response, so to assess the auditory nerve functioning. Then tympanometry helps to identify whether the tympanic membrane is working properly. Then evoked autoacoustic emission. It measures sound originated in hair cells of cochlea using microphone and transducer. So assessing the inner ear function, we are using EOAES, or evoked acoustic autoacoustic emissions. Okay, with the help of this test, we can identify whether the hair cells of the cochlea is functioning properly or not. Let us see the management. The main goal of the management are to restore hearing, to assist in hearing, and to manage tinnitus and implement oral rehabilitation. This is the main three goals behind hearing loss. So we'll see one by one. So for restoring hearing, what all things we can do? Hearing loss that result from blockage or fullness in the ear associated with an infection may be restored to normal with administration of antibiotic for bacterial infection. So if the hearing loss is occurring because of some obstruction or infections, that we can treat with antibiotics or any other medication. Then in case of sudden hearing loss, promote administration of oral corticosteroids. So administration of oral corticosteroids and antibiotics will help for restoring the hearing. Then assist in hearing. Unfortunately, most hearing losses are permanent and hearing cannot be restored. So once if the hearing loss is permanent, then it cannot be restored. The use of hearing aids and assistive listening devices can greatly improve the client's ability to communicate and interest with others. Even if it is a permanent hearing loss also, you can, with the help of some hearing aids or assistive learning devices, we can improve their ability to communicate. Then early detection and intervention are crucial to minimizing the impact of hearing loss. Okay, so one of the main preventive measures is early detection and intervention. You have to diagnose it early and you have to treat it properly. Okay, it will helps to minimize the impact of hearing loss. Okay. Then, in infants and young children with hearing loss, early identification and management through infant hearing screening programs can improve the linguistic and educational outcome for the child. So, especially in children, sometimes if they are very poor in performing their academic and all, so definitely we have to go for a detection or identifying of any hearing loss, because hearing is one of the main component of communication. So if there is any hearing loss, that can lead to their communication skill. Then some of the treatment also mentioned here: removal of ear wax, then hearing aids, cochlear implant. Okay, this all will help for improving hearing ability. Then if it is a conductive hearing loss, then hearing aid are available. Sensory neural deafness means for sudden deafness we can use ear steroids, okay, drops, then vasodilators, vitamins. Okay, we have seen that A vitaminosis will be there. So vitamins should be given: B1, B6, B12, A, C, and D. Then carbogen, that is 5% carbon dioxide with 95% oxygen. It will help to improve blood circulation in the cochlea. So sometimes if the hair cells of the cochlea is not working properly, that is also a cause for sensory neural hearing loss. In that condition, we can give an medicine, that is carbogen, it including 5% carbon dioxide and 95% of oxygen. It will help to improve the circulation in the cochlea. Then for chronic deafness, we have to go for hearing aids, cochlear implants, okay, and auditory training and lip reading. Okay, that is also hearing techniques, auditory training and lip reading. Then cochlear implant means there are small electronic device which stimulate auditory nerve, provide sense of sound. It will be used by profoundly deaf, then children age 2 to 6. So in the picture you can see that is a cochlear implants, or they are small electronic device which will helps to stimulate the auditory nerve. Okay, so that they can easy to hear. Then aided by speech therapy, with the help of speech therapy you can use this cochlear implant. Then the surgical management are surgery is indicated for conductive or mixed hearing loss, not for sensory neural. Surgery is only indicated for mixed and conductive hearing loss. To restore conductive hearing loss, meningotomy and stapedectomy. So in otosclerosis or in tympanic membrane perforation, due to this condition, we can go for meningotomy and stapedectomy. Then assisted hearing in profound deafness, we have to go for cochlear implants. Internal cochlear implants will be there. Then temporal bone stimulators. They are also bone hearing devices. They are attaching to the temporal bone. So bone conduction, it will help to improve the bone conduction. Thereby they can identify the sounds. Then middle ear implants, like semi-implantable hearing devices are there. Cochlear implants are there. Then tumor excision for acoustic neuroma. If it is occurring due to acoustic neuroma in mixed hearing loss, one of the causes acoustic neuroma. So in that case, we can go for tumor excision. Then other thing is oral rehabilitation, that is also a management. It is a process of identifying and diagnosing a hearing loss, providing different type of therapies to clients who are hard of hearing. and implementing different applications devices to aid the client's hearing abilities. So oral rehabilitation like cardiac rehabilitation or respiratory rehabilitation, this is also a oral means that is related with ear or hearing. Okay, AURAL. So in this rehabilitation, what they are doing means it is a process of identifying and diagnosing hearing loss. First of all, they are identifying and they are diagnosing. They will identify which type of hearing loss and they are identifying what is the cause behind the hearing loss. And they will provide different types of therapies, it including hearing aids, lip reading, then some other type of reading, sign reading, okay, and implementing different amplification device to aid the client's hearing ability. They will try different amplification devices in order to improve the ability of hearing. Oral rehabilitation, including hearing aid orientation, sign language, and lip reading. These are the main components of oral rehabilitation. Goal of oral rehabilitation is including sensory management to optimize auditory function, instruction in the use of technology and control of listening environment. They will provide the instruction regarding how to use the technology or the devices and how to listen environment. Then perceptual training to improve speech, perception and communication. They will help them to learn the sign reading, lip reading. Okay, so deaf people can able to read or communicate us with lip reading. When we are talking, that time they will observe our lip movement. From the lip movement they can identify what you are talking. Counseling to enhance participation and deal both emotionally and particularly practically with residual limitation. They will try to help you psychologically with improving with the residual or remaining how much hearing ability is there. With that, they will helps to improve your hearing ability. Then components including sensory management to target and enhance auditory function, instructions to increase the probability of positive outcome from sensory management. They will help us to improve or to construct a positive outcome for sensory management. Then perceptual training to target activity by supplementing the learning opportunities provided by everyday communication. So a proper learning training will be there. So with the help of everyday communication, they will helps to supplement the learning opportunities. They will help us to understand how to learn they how to learn each and everything. Then counseling to target issues of participation and quality of life that result from residual deficits of function and activity. So hearing loss people having some kind of emotional problems will be there, psychological effects will be there. That all things will be eliminated or minimized with the help of proper communication. So in that, they will help us to participate in this learning process to improve the quality of life. Then how we can prevent this kind of hearing loss, like immunization for childhood disease. In the beginning, the causes we have seen that there are a lot of viral infections and bacterial infection can lead to deafness. So proper treatment with the help of immunization will helps to prevent childhood deafness. Then avoid high decibels. Okay, avoid to listening high decibel sounds. Okay, then how hearing tested in between yearly or 6 month you can go and you can test your hearing. That will helps to prevent hearing loss. Then use hearing protectors. If you are in an atmosphere where loud sounds are there, try to use ear protectors like ear muff or ear plugs. You can close the ear with a covering, or you can keep the ear plugs so that the too much loud or noisy sound will not enter the ear. It can prevent hearing loss. Then role of nurse in communicating with the hearing impaired and muteness, it including speak clearly and naturally. So what one of the main role of the nurse is how we can communicate or how we can give the education regarding this impaired people and muteness. Speak clearly and naturally. When you are speaking, you have to speak clearly and naturally. That will help them to understand. Move closer to the listener. If they are having deafness or if they are having hearing loss, then you have to move closer and you have to talk. Then face the listener while speaking. When you are speaking them, if they are having hearing loss, you have to always face them directly. You have to look on their face and you have to talk. So they can identify. They can easily they can identify the lip reading. Then restate your message if needed. Then restate your message means once again you have to you have to clearly define. Then do not cover your mouth while talking in front of a hearing loss people. Don't cover your mouth. Be patient. Okay, you should having more patience. Encourage to use hearing aid. You have to encourage them to use hearing aid to improve the communication skill. Encourage client to read lips if that helps. Okay, tell them to read from the lips of the of the speaker. Then lower pitch of voice. Always you have to use low pitch of voice. Direct speech to stronger ear, but do not shout. Okay? So if they're having partial hearing loss, then you have to speak through the ear which is having strong ability, but you should not shout. Then use gestures when possible to clarify statement. You can use your fingers or gesture symbols, which will help to improve the communications. Write when necessary. If it is not possible, then you can write somewhere and you can show to them. Learn basic signing if appropriate. If you are working in a hearing loss, working in between hearing loss people, then you have to learn the basic signing, how to communicate with this hearing loss people or deafness people. So this will helps to improve the communicating skill between nurse and patients. So these are the measures. Then there is an assignment for you, nursing management for hearing loss or deafness, and you are also write the health education. So this all about today's topic, hearing loss or deafness. So it is very important for your examination. So we have discussed about what you mean by hearing loss or deafness. Then we have seen what are the risk factors, what are the causes, types. Then pathophysiology we have seen, and afterwards we have seen what are the possible signs and symptoms, what are the diagnostic evaluations, then the management or treatment. So in that we have seen that oral rehabilitation, then surgical management also we have seen, and what are the possible preventive measures for prevent deafness in children. Then we have seen how we can role of a nurse to communicate with a deaf or hearing loss person. So this is all about today's topic. I hope all of you clear about today's topic. Thank you. Have a nice day.